Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your question on injuries, training, rehab, or technique. We'll be taking your phone call shortly. Call 856-767-8884 or toll free 888-634-7488 for your direct line to Sports Doctor. Now here's your medical reporter for tonight's show, Joe Chapana.
All right, thank you for joining us. This is Sports Doctor. Sports Doctor is brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, Washington Township, Pennsville, Swedesboro, and Vineland. We're live for the next half hour. Tonight we're going to be talking general sports injuries. So if you have a question about something you're experiencing, feel free to give us a call. Our toll-free number is 1-888-634-7488. We have a local line available to you as well. That number is 856-767-8884. Tonight, answering your questions, we are pleased to have Dr. Mathew Pepe with us. He's from the Rothman Institute. Dr. Pepe is an assistant professor of orthopedic surgery at Thomas Jefferson University Hospital and is an attending orthopedic surgeon at Atlantic City Medical Center. He practices in southern New Jersey at the Egg Harbor Township and Voorhees offices. He specializes in sports medicine and shoulder surgery. Next to him is Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy Sports Medicine Center. Dave, we'll start with you. Let's talk about the knee joint.
Sure, let's do that. And excuse my voice a little bit.
Dave was at the Flyers game last night.
Okay, this is a right knee. Let's do the bones first. This is the femur. This is the tibia. This is the fibula. This is the kneecap. Notice the patella. Some of the tendons here. Superior patella tendon, inferior patella tendon. Turn it medially here. This is the medial collateral ligament. It's the lateral collateral ligament. Now let's go inside. This tremendous joint here. This is the medial meniscus. It's the lateral meniscus. This is the anterior cruciate ligament. Did you get that? The medial meniscus and the lateral meniscus. And this is the posterior cruciate ligament right here. And that is the knee.
A lot going on inside the knee joint, Dr. Mathew Pepe. What are the most commonly injured structures of the knee joint?
Well, Joe, the most commonly injured structure is the meniscus. Typically, as Dane pointed out, the meniscus is a semicircular pad between the two bones. And a typical injury is with a pivoting injury or a squatting or hyperflexion injury. Following that is an injury to the collateral ligaments, either the medial collateral ligament on the inside of the knee or the lateral collateral ligament on the outside of the knee, followed by a cruciate ligament injury. Pull the kneecap out of the way. And here is the anterior cruciate ligament, which runs from the femur to the tibia. And now the anterior cruciate ligament prevents the tibia from coming forward on the femur. And a typical mechanism of injury is a non-contact pivoting or cutting type of maneuver in which the athlete's knee will plant and twist, and that anterior cruciate ligament will pop and the knee will swell.
And there you have the old ACL injury. Now, you mentioned the meniscals being one of the more commonly problems with the knee joint. What treatments are available for meniscal tears?
Well, Joe, there are really two main treatments. The first is a non-operative treatment course, which can be effective in people that have smaller tears or what we call degenerative meniscal tears associated with arthritis. And they respond to a combination of injections as well as therapy and strengthening for the knee. Usually when that fails, we can consider operative treatment, which involves arthroscopic surgery. Now that type of surgery is when we make small incisions in the knee, usually 2 or 3 small holes in the knee, and we work with small instruments to either repair the meniscus or take out the torn portion of the meniscus.
All right, Dave, you're a physical therapist. What can you do with a patient with a meniscal tear in physical therapy?
Well, I was out there Pepe nicely explained really what the purpose of the meniscus is. Basically, it really works as usually, I tell people, as the shock absorbers of the knee, very much like your shock absorbers of your car absorb the stress and the weight of your car as you're going down the road and you go over bumps. This meniscus absorbs the stress and the weight of your body when you're walking and running. So what we try to do, if there's a tear in it, we really want to try to alleviate that pressure on that knee. So we're really working on strengthening the quads, the hamstrings, and the medial and lateral structures that support the knee to take the stress off the meniscus itself. We know that if we do that, then that will absorb a lot of the stress and not go onto the meniscus. And one of the things that we really like doing with our centers, we have 3 aquatic centers, so we really like putting the patient in the water at first because we know that at waist level we're decreasing the compressive forces by 50%. And then at shoulder level we're decreasing by 90%. So it's allowing us to do some of the strengthening exercises as well as getting more into some of the functional activities as walking and running without putting any stress on the meniscus right away.
Okay, we're talking general sports injuries. You're watching Sports Doctor. You can reach us toll-free with your questions at 1-888-634-7488. Our first caller is from Boyertown. Mike, welcome to Sports Doctor. Go right ahead with your question. Mike, are you there? I think we lost Mike. All right, let's talk about meniscal transplants. But before we do, let's see if we can get Mike one more time. Mike from Boyertown, are you with us? Mike from Boyertown?
Yeah, I'm here.
There he is. Go right ahead with your question.
My daughter, she is 16 years old, has been diagnosed with multi-dimensional instability in her left shoulder, where it's loose and it goes through its subluxation all the time. Well, she can do it on demand, actually. And they're talking about doing some surgery on her. I was wondering if you could explain what that would entail.
Okay, got the right guy for the job here.
Well, Mike, multi-directional instability of the shoulder is it's really a complex problem. We try our hardest to treat it non-operatively first, if that's at all possible. And we like to do at least 6 months of both a home and an outpatient-based therapy program to strengthen the rotator cuff muscles and to stabilize the shoulder. When that fails, your surgical options involve essentially tightening the ligaments around the shoulder joint. And this can be done the classic way is an open approach through an incision in the front of the shoulder, but nowadays just as effective, it seems, is an arthroscopic approach where we do what's called a capsular plication, and we tighten all the ligaments around the shoulder joint. And it's fairly effective at alleviating the symptoms.
All right, Mike, thank you for the phone call. Good luck. Our toll-free number is 1-888-634-7488. Don't forget, Crosskeys Physical Therapy offering free screenings for the next 2 weeks, and at the end of the program, we'll hook you up with numbers for the different centers to take advantage of that offer. Right now, we're going to talk to Joe in Cherry Hill. Joe, you're on Sports Doctor. Go right ahead with your question.
Good evening. I recently had my right knee scoped. I had a torn meniscus. I work as a football official. And that was done back in early February, and I've stayed off of it pretty much for about 2 months now. I'm just getting back into the cardio on the non-impact machines. I have no problem with leg lifts. Stay away from squats. But my question is this. At what point will I stop feeling pain on the left or right side of my knee after doing 20 minutes to 30 minutes of cardio? Because what I find is that the next day, if I'm just in a stationary position, I just can't automatically get up and go. I got to, like, ease into it.
Okay, first of all, is that normal or is that...
Well, it depends on what the other structures in your knee look like, Joe. If there was a fair amount of arthritis, then typically it can take some time to warm up your knee during the day. And then people can have some residual pain if the knee is arthritic after meniscal surgery.
One of my concerns basically is that you're really you're doing a lot of cardio, which is really great because I know you need to do that as a referee, but you need to continue to do the strengthening exercises to, once again, as I was talking about earlier, to take the pressure off the meniscus. You need to strengthen the quads and hamstrings and the medial and lateral structures of the knee joint to take the pressure off of it. So hopefully you're doing that as well and hopefully not doing it the same day you're doing the cardio, because you might overwork it, and fatigue it.
Mike, it sounds like he'd be a great candidate for that free screening offer from Cross Keys Physical Therapy. So hang on. At the end of the program, we'll give you numbers for their various centers, and all you need to do is schedule an appointment to take advantage of that offer. We're coming up on our first break. We want to remind you our lines are open, toll free, 1-888-634-7488, locally 856-767-8884. It's general sports injuries tonight on Sports Doctor. More right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
The Rothman Institute, the #1 orthopedic care team in the region. Freedom of movement at any age.
Great, Grandpa.
Call 1-800-321-9999.
Hey, this is Sports Doctor. Tonight we're talking general sports injuries. We're live. We're taking your phone calls. Our toll-free number is 1-888-634-7488. Locally, 856-767-8884. We're joined by Dr. Mathew Pepe from the Rothman Institute, and also Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy. Let's go to the Jersey Shore. Bill from Ventnor is on the line. Bill, go right ahead with your question on Sports Doctor. Bill from Ventnor, go right ahead.
I had a knee replacement 3 years ago, and it's still hurting like heck. I'm doing all my exercise and all too.
Okay. First of all, thank you for saying heck. And, still having pain. Is this something that should be addressed by someone?
Well, typically knee replacements do hurt for 6 months to a year after the surgery. But in general, I tell patients that they are like wine for that first year. They do get better, but if you're still having pain after 3 years, I think you said, then there may be a problem with the knee. And so you should have that evaluated by somebody that's skilled in looking at knee replacements and knee replacement surgery to see if there's a mechanical problem or something else wrong with that knee replacement.
Someone like yourself, right?
Someone like myself.
Orthopedic
That's
surgeon.
right.
Dr. Mathew Pepe, orthopedic surgeon, Rothman Institute. Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy. Toll free, 1-888-634-7488. On Sports Doctor, our next caller is from Millville. Charles, welcome to Sports Doctor. Thank you for calling in. What can we do for you tonight, Charles?
Well, I have a question, and they may have just answered it. I had my TV down, but I had a total knee replacement last May the 30th, and it was my right knee, and the knee is still very swelled. It's probably an inch bigger than the left. That's what it was before the operation. And the doctor told me, he took x-rays of it, and he said there's nothing he would have did any different in there, and it's a little puzzling here why I have an awful lot of pain in it, but I go to the gym every day. I can ride a bike for like, we'll say 7 miles.
Okay.
It hurts.
Swelling and still some pain since a replacement May 30th.
Well, the concerning thing is the continuation of the swelling, and if there is fluid in the knee, then the doctor really should take some of that fluid out and send it to the lab to evaluate it, because the one thing we all worry about as surgeons and especially with joint replacements, is an infection. And although it's pretty rare, I think it's worth looking into.
All right, Charles, thank you for watching. Thank you for the phone call. Our toll-free number is 1-888-634-7488. Jerry's our next caller from PA. Jerry, thank you for watching Sports Doctor. Go right ahead with your question.
I was in an accident about 2 years ago, and I went to therapy for close to about a year, and then I went to see a specialist about my arm. They said it was frozen shoulder, and I'm diabetic, and the therapy helped me out a lot, and I'm at like a standstill now. I'm wondering what should be the next thing to be done.
Okay, we got a shoulder specialist on the show tonight.
Well, I mean, the first line of treatment for a frozen shoulder is as you had, is a good and aggressive therapy program. And I usually send people to an outpatient program for 2 to 3 months and then transition them to a home stretching program. And it's important that you stretch every day on a daily basis, at least 2 to 3 times per day. And once people plateau, your pain doesn't improve or the motion doesn't improve, then operative treatment really is discussed with the patient. And that involves putting the patient to sleep. You can do a gentle manipulation while you're asleep. If the motion does not return, then sometimes you have to supplement that manipulation with an arthroscopic release of all the scar tissue in your shoulder. And that's very effective in relieving your symptoms.
You frozen shoulder, see a lot of that with physical therapy?
Yeah, we do. And as Dr. Pepe said, you really got to be really aggressive. But it sounds like the man had a year of it already. I don't know how aggressive they were, but if you're not seeing the results, like you said, the scar tissue binds down, and the next phase would definitely be surgery.
All right. Thank you for watching. Thank you for the phone call, Jerry. Let's take another caller. Derek from Philadelphia. You're up. You're on Sports Doctor. Go right ahead with your question, Derek.
Okay, how you doing?
Good.
Okay, first I had scope surgery on my left knee here, and they thought it was a meniscus tear, but it wasn't really meniscus. They said there was a lot of arthritis buildup, and they grounded some down. And I continued to have swelling and fluid buildup in it. Then a few months later, I had an amputation, but that doesn't bother me. The knee still bothers me from arthritis and fluid buildup. Why is that?
I'm a little confused. You said
Did he say amputation? Did you say amputation?
Listen, I had scope surgery done on my left knee.
All right. Got that.
Okay. Then a few months later, I was in an accident and had an amputation below the knee on that same leg.
Okay. Same side.
The amputation doesn't bother me.
Right.
The scope surgery, when they took the arthritis, they said it grounds some arthritis out of there. I still get fluid buildup and arthritis pain in the knee. I still have a knee.
Okay.
And it's hurting, unfortunately.
Okay.
Well, your options at this point, if the arthritis is severe, and how old are you?
Derek, are you there?
Yes.
How old are you, Derek?
48.
48?
48, so you're young. So we would try to do everything possible to avoid any type of knee replacement surgery in you. And there are injections that you can do, either what we call viscosupplementation injections or what we call the rooster injections that are made from a crown of a rooster, and also occasional use of cortisone injections to try to buy you some time. And if these aren't effective, then depending on what else is going on in your knee, there are some other types of joint-sparing procedures that we can do. But if the arthritis is severe, then usually the end result is a knee replacement.
Before we get to Jim in Pennsylvania, what age do you start considering the replacement?
Well, I mean, we consider replacements in all ages, but we don't like to perform them until people are at least 50 years of age.
Okay. All right. Thank you for watching. Thank you for the phone call. You can reach us, too, with your questions at 1-888-634-7488, as Jim has done from Pennsylvania. Jim, you're on Sports Doctor. What can we do for you tonight, Jim?
Yes, hi. My son is a pitcher, and he's a 14-year-old pitcher. He went for professional pitching lessons, so he's not throwing without having some kind of structure. He fractured his growth plate, and we shut him down for a month and went back to the doctor. Everything was okay. They started him slowly back into playing baseball and now back into pitching. And the other night, when he went to throw the ball, he felt a pain. We took him back, and they said that there's inflammation around the growth plate, and we have to completely shut him down again. Is this something that will continue to bother him? Or
Yeah, what do you think, Dr. Pepe?
Did he have an injury, or this
was just from pitching? Growth plate. He throws the ball up in the mid-70 mile an hour. He's only 14.
Okay. So you're referring to something, it's called an osteochondrosis or Panner's disease of the elbow. And it happens in kids that are growing, and it really is self-limited. But you need to shut him down until he really is pain-free. And once his growth plates close, he will become asymptomatic, and he'll really be able to do everything he wants to do. So it's important to shut him down completely until his pain goes away. But he'll need to be followed with x-rays and evaluations by an orthopedic surgeon.
All right. Thank you for watching. Thank you for the phone call. You can call us too. 1-888-634-7488. I guess our next caller is Dan from Philly. Dan, you're on Sports Doctor. Your question tonight for our guest.
Hi, Dr. Pepe. I had 4 surgeries to my elbow. First I had 2 shaves on both sides because I had a bad nerve, almond nerve in there. Then I had another one. He relocated it on one side, and then I had a vein graft, and it still hasn't worked. He just said that it's probably going to be like this. Did you ever hear of anything like that?
So are your symptoms pain, or is it more the weakness of that nerve?
I had burning sensations in my arm.
Well, it does happen. Unfortunately, sometimes the nerve gets compressed to a point where it doesn't function well, and your options at that point aren't very good. And there are some very good medications that you can treat the chronic nerve pain with. But at this point, surgery probably isn't an option for you.
Dan, thank you for watching. Good luck with that. Thank you for the phone call. We are going to take a short break. We have Barry on the line from Maple Shade. If you'll hang with us, Barry, we'll take your call right after this break. Also, we'll take your phone calls, too. Our toll-free number is 1-888-634-7488. It's Sports Doctor. More of our program right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
The Rothman Institute. The #1 orthopedic care team in the region. Freedom of movement at any age.
Great, Grandpa.
Call 1-800-321-9999.
Hi, I'm Brian Greenberg, host of College Bound. Join us each and every week at 9 p.m. as we focus on issues relative to the entire college planning process. Our mission, to educate and inform parents and students so that you can get the best education at the best price. More importantly, we want to help reduce the stress and anxiety parents and students go through as they prepare to enter college. Join us each and every week at 9 p.m.
Sports Doctor is brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, Washington Township, Vineland, Pennsville, Swedesboro. They're offering free screenings for the next 2 weeks. At the end of the program, we'll put up numbers so you can call, make an appointment, take advantage of that offer. From Cross Keys, we have David Anselmo with us, physical therapist and the owner, and also with us from the Rothman Institute, Dr. Mathew Pepe. He's an orthopedic surgeon, and he's available for your phone calls, as is Dave. Our toll-free number is 1-888-634-7488. Barry is holding from Maple Shade. Barry, are you still there?
Yes, gentlemen. Thanks for taking my call. Real quick, back in the 70s, I had a trauma to my left knee, football injury, tore everything, total knee reconstruction. Following year, knee reconstruction again, same leg. In the 80s, from favoring that leg, the right leg, total knee reconstruction. Following year, knee reconstruction. 2000, a knee replacement. 2001, revision on that replacement. 3 weeks ago, I tore up my left knee. I went MRIs, x-rays. I was told I needed a knee replacement, but it's not urgent. Where do I stand?
Well, how old are you?
47.
47. Oh, geez. So the arthritis sounds like it's severe on that other side. And unfortunately, many times when you tear up the knee in a sports injury, even though we reconstruct the knee, sometimes people do go on to arthritis. And if the arthritis is so severe that, you know, that if you're bone on the x-rays and they're saying you need a knee replacement, then that really may be your only option at this point, unfortunately.
All right, tough situation, but thank you for the phone call. You can reach us at 1-888-634-7488. From Sicklerville, we have Terry on the line. Terry, go right ahead with your question on Sports Doctor. Terry, are you there?
Yes, I'm here.
Hi, go right ahead with your question. Hello? Terry?
Sure, Dr. Pepe, I've had 5 Suparts injections about 5 months ago, and I need to know how much mileage I can expect and when you think I should get the next treatment. They're very painful, and I was hoping to get more than 6 months out of it.
So you're telling me they're not working for you at this
They
point?
are working for me, but the doctor, I'm actually going to Rothman, and he recommended that I not wait too much past 6 months. But I'm apprehensive to get it done again because it's very painful.
Could you explain what that is?
Sure. The Suparts, as Terry knows, it's one of those visco supplementation injections. So it's made from the crown of a rooster, and it's designed really to lubricate or to provide more shock absorption in the knee. And some people do find them painful, and unfortunately you need to do a series of 3 to 5 shots, so it's not the most enjoyable treatment. But many people do get great relief out of them. If it's still working for you, Terry, then I suggest you just ride it out as long as you can.
All right, let me interrupt there. Unfortunately, we're out of time. We have Joe from Philly. If you hang on the line, we'll talk to you off air. I want to remind our viewers that Cross Keys Physical Therapy is offering free screenings for the next 2 weeks. To take advantage of that offer, just call one of their centers. You see the numbers on the screen there. Sicklerville, it's 856-728-1900. Woodbury, 856-853-0988. Washington Township, 856-374-3707. Pennsville, 856-678-8000. Vineland, 856-794-8330. And I want to thank Dr. Pepe for being with us from the Rothman Institute. You can reach him at 800-321-9999. We also have to say happy birthday to somebody.
Paul Miller. Happy birthday. How old is he, Joe?
I think he is 45.
45. Tomorrow. Happy birthday, Paul.
We'll be back a week from
all
today.
of us.
Until next time, Sports Doctor, thank you for joining us.